You're listening to the Military Working Mom Podcast with Drea Jones, episode 39, and today we're going to talk about recovering your body after C-section and vaginal birth with our special guest, Dr. Amanda Fisher of Empower Your Pelvis Pelvic Floor Physical Therapy. This episode was sponsored by Miss Military Mom. Welcome to the podcast, Amanda.
Hi, thanks for having me.
Of course. Well, okay, so you are the C-section expert as far as in my knowledge. So we are so glad to have you on just to kind of expand our knowledge and our expectations for those moms that, have to have a cesarean. And if you are aware or not, in the military, we have a quick turnaround to become fit. And honestly, that we're kind of an environment that we strive to always be fit. So I think having you on is definitely going to make sure that we can recover fast without injuring ourselves. So for everyone listening, go ahead and just kind of tell who you are, what your background is, and what your story is.
Yeah. Okay. So I'm Amanda Fisher. I am a physical therapist. And while in physical therapy school, I started peeing my pants while running at the fine age of 22 and started having pain with sex at that time too, which in physical therapy school, you learn that how muscles are supposed to work and do their job. And we had learned that the pelvic floor was supposed to actually, stop things from coming out, and except when you needed things to come out, then they could relax. So it didn't make sense to me that I was peeing my pants while being a strong endurance athlete. And then the pain with sex at that time, I just had no idea, why I was having pain with sex, because Cosmopolitan told me that sex is supposed to be all rainbows and, fireworks, and I wasn't having that same experience. So I was very confused. Nobody was talking about it. And this was probably like 2008, 2009. And then while in PT school, I was away at a student conference and basically pulled the short straw to go learn about women's health, was what it was called at the time. And while sitting in a course, realized like, oh my God, that's me. I have pain with sex. Oh my God, that's me. Like I pee my pants. And realizing that I think I didn't want to go into sports med anymore, and I wanted to kind of start traveling down the realm of women's health. So that's what kind of led me into what we now call pelvic health, which was great because at the time we were like, well, great, well, men have pelvic floors too. Why are they not included? Like, how can we include them into it? So we ended up changing our name to pelvic health. I probably started out in the pelvic health realm at the time. Women weren't getting into it until after they had children in the pelvic floor physical therapy. But then that has since changed, because now pelvic floor physical therapy is really a specialty that they teach you in school. Again, back 10 years ago, they weren't doing that. So we were leaving, myself and another classmate would go over Christmas break to learn about the pelvic floor and travel across the United States to do so, which was fun and exciting, but also kind of sad that it wasn't part of our schooling yet. I got out of school. You graduate with your doctorate in physical therapy. And I came back to the Kansas City Lee Summit area and started a pelvic floor program for an outpatient ortho clinic. So I could still do sports med, which I loved, and still start in on the pelvic floor stuff. We treat way differently now in 2020 than we did back then. Because back then, 10 years ago, it was all about the Kegels. And now we know it's not all about the Kegels. Stop doing Kegels. It's probably making things worse. I had my first child while developing this program. And as a pelvic floor PT, your whole goal is, we know the pelvic floor, I feel like, better than anyone and how it's supposed to work. So you want a vaginal birth, right? That's what everybody strives for. And I ended up with an emergency C-section, and my life was shattered. I am what I would consider in my head a super mom and a go-getter, and that put me on my butt for 8 weeks of basically bed rest, of not doing anything. And I hated it. We weren't given a manual. Like, I remember sitting in the hospital thinking, like, I know what I'm supposed to do, but I still want someone to tell me what I'm supposed to do. And nobody's telling me what I'm supposed to do besides that I need to get up and walk. And dealing with so much pain and discomfort and not knowing really what we were supposed to do after a C-section just kind of started messing with me. And that was about 7 years ago. So I have had 3 C-sections total, because my kids, I have 3 boys, and they're 7, 5, and almost 3. And with each kid, I started kind of putting together a program for myself of like, okay, like if this VBAC doesn't turn out as a VBAC and it turns out as a C-section, what am I going to do? How am I going to recover? What would I want my patients to know? By the third one, which was also, I mean, we knew we were going to have a C-section, but it was still an emergency because it happened way sooner. By then I was like, absolutely, like, this is what I'm doing week 1. This is what I'm doing week 2. We ended up in the NICU, which is a whole nother story of where women need some help too. But going through like everything that I wish someone would have told me, or I would have been there with a patient, which then now on our website is turned into the C-section recovery guide. Because I feel like even whether you had a vaginal birth or a cesarean, like we hear, don't do anything for 6 weeks. And you're like, okay, I won't do anything for 6 weeks. But like, if it was any other injury in the body, we wouldn't treat it that way. We would want to get some blood flow there. So I really like let my women know who reach out via Instagram or Facebook or online, like when you're told not to do anything for 6 weeks, that means like exercising, like running and jumping. But you got to think like, when I had my second one, I was like, I'm not supposed to do anything, but I still have a baby and a toddler at home I'm taking care of. Like there has to be something of what I can do and how much weight I can lift. So it really starts out on our program of like building up the foundation. Like, how do we make sure we can get our breath connecting with our pelvic floor again? How do we get our pelvic floor moving? What areas can we stretch out tissue? Because things are going to get tight for moms, whether they're sitting on the couch all day or holding and snuggling all day. Like certain parts of the areas, no matter, again, C-section or vaginal, are going to get tight. And then trying to connect the lower abs again and going over scar tissue mobility. Like there's so much that we can do to help heal as mothers and women, especially y'all in the military. I mean, you guys are intense. And if we don't lay your foundation, then we're trying to break up everything that you guys have been pushing for to retrain your tissue later. And that's just so much harder for, I think, for anyone to be able to do that. So I think it's very important to get it going from the get-go than trying to backtrack on it.
Yeah, no, you hit on so many things. So I think you blew everyone's mind when you said Kegels are not so great, because every time I mentioned pelvic floor therapy, and honestly, I didn't know what a pelvic floor therapist was until months after I had a kid. They're like, oh yeah, Kegels. I'm like, oh, not really, but okay, whatever. But you also said you were down for 8 weeks. And I know that magic 6 numbers in everyone's head. And right at that 6-week mark, they're like, all right, I can run. And you just basically said that's not always the case.
No.
If not the majority of the time, not the case.
Right. And I will say, like, I'm not perfect. I totally made that mistake after my first kiddo. Because I like to consider, I've been an athlete my whole life. If I wasn't doing sports, then I was out running, training for half marathons or triathlons. So I ran through my first pregnancy until I couldn't anymore, because I started spotting, because I was planning on training for a half marathon. And then my 8-week mark, after my first C-section, I went out for a 3-mile run, because that is, again, my body's used to endurance. I usually don't have to train for that thing. And I ended up with bladder prolapse. So it's not the smart thing to do. But you do hear, like, there was not really a protocol back then of like, what do you do to get your body to strengthen back up? So my pelvic floor muscles were shot from being on bed rest and pregnancy. I didn't deliver vaginally, and it doesn't matter. Like, the muscles are still involved with a cesarean delivery, and they needed to be strengthened. And I didn't do that with my first. So then when I put all this high intensity pressure through it to go out for a run, like, I ended up giving myself bladder prolapse, which is terrible, because then now I've had it after each of my kiddos. And I've had to learn how to manage and, strengthen everything back up so I don't have those symptoms. And for those of you that don't know what bladder prolapse is, like, your pelvic floor muscles are supposed to hold up your organs. They're supportive muscles. And so your front wall of your pelvic floor holds up your bladder. The back wall holds up your rectum. And then all the pelvic floor muscles help support your uterus. And if the pelvic floor muscles are weakened, or maybe the ligaments of those organs are weakened, those organs can come into the vaginal canal. So it's not the organ exactly, like the bladder's pushing on top of the pelvic floor or into the pelvic floor muscles, that's what's coming into the vaginal opening for the bladder and the rectum. And I was feeling like I had a used tampon in my vagina after running and jumping, or sitting in a recliner nursing my kiddos at night because I was putting my pelvic floor in a bad position. But that all came from me getting back into running and exercising before my body was ready for it.
That doesn't sound fun at all.
No, like who wants to put the tampon in your vagina when you don't have one in there? That's not fun at all. It makes for other issues. So, yeah, it wasn't a cool thing to do. I had to learn to put my PT hat back on and simmer down and take time to build everything back up instead of doing what my brain told me as a competitive individual, which was like, get your butt out there, get back in shape. And it wasn't ready yet.
So real quick, we have to take a break because in the beginning, Amanda said she was wearing a vagina costume because obviously it's near Halloween when we're recording this. So for everyone watching on YouTube, I would love for you to stand up and let us see what this looks like.
So our vulva, my office manager made us all vulvas for Halloween. So we have some nice large gaping ones. This is my childbirthing one. One of our girls has a little bit smaller, smaller one, and I'm like, it's because she hasn't had kids yet.
That's hilarious.
Yes, so that's what we say in the office.
Okay, so to focus on C-sections, because honestly, one of the biggest misnomers that I hear, and though I've had to learn myself is, when you think of someone that has a C-section, you're like, oh, well, obviously everything down south is fine because a baby didn't come through. Where you were just mentioning you had prolapse, which, many people that even have, not natural births, I don't want to say it like that, but vaginal births don't have or can have. So what's the difference between C-section recovery and a vaginal birth recovery?
That's a loaded question. Difference in recovery. Okay, so let's start with level 1 would be like vaginal birth, no tearing. So it's kind of like a whiplash injury. Might take a couple weeks. Those women typically don't complain of too much, of maybe just a little bit soreness. Maybe they feel like they got back to themselves, like their body back, of feeling normal, that they could do something, probably around 2 weeks. So for those women, we have to tell them, like, even though you feel that way, your body's not quite ready for that type of activity. Same goes for like a grade 1 tear. Grade 2 might take a little bit longer. Typically it's the grade 3, grade 4 vaginal tearing where I think should be a absolutely requirement to see a pelvic floor PT after you have a grade 3 or grade 4 vaginal tear. To me, we're really getting into a lot more tissue in the pelvic floor region, similar to, tearing a rotator cuff or an ACL or, any other body part. You would have a referral most likely to a physical therapist that you would work on tissue healing, lengthening tight tissue, strengthening weakened tissue, getting the nervous system working back together again. But we have not done that with our female population, especially prenatal or postpartum, and it doesn't really make sense. So we've really been pushing that here in our clinic for the last year, and until COVID hit, and then we pushed it again. But C-section, I like to group in with that grade 3 and grade 4, that it should be an automatic referral as well. It's major abdominal surgery, as is a hysterectomy. So we really need to see those women too. I mean, you are going through so many different layers of tissue to get down to the uterus. And then that scar tissue has to grow, and it's going to attach onto anything. It has no boundaries. It doesn't care where it anchors on. It just wants to heal the body. So the uterus sits behind the bladder, and the scar tissue on the uterus can actually hinder mobility in the bladder. So some of our C-section moms may even experience like urgency, because when that bladder wants to stretch, maybe that scar tissue isn't allowing it to stretch as much. So it's giving them that signal of, I gotta go, I gotta pee all the time. And sometimes it takes them coming in and us actually moving the tissue around that to help release and create some of that mobility for them. Some of them will have low back pain because that scar on the uterus, you've got ligaments that bring it back to the low back region, and maybe it's not moving as well, or it's getting pulled forward. So it's going to be causing more tension back there too. So us learning how to release the scar and give them more mobility so it's not pulling as hard in the back, and help them relieve some of their low back pain. Working on the scar tissue can also help wake up the nervous system down there and release some of the tension and tightness around the muscles that are in our lower abdomen. So we can start to retrain the lower abdomen to work with our core, with our pelvic floor, to help with stability. So it's a different recovery, given on what kind of birth you do have. I will say more of our grade 4 and C-section moms are our longer patients, where we may not see, a non-tearing vaginal birthing mother to a grade 2 for too long, but it really depends on how long it takes for them to get their system moving well again. I will say though, for any of our women that we've been seeing during pregnancy, if we can teach them things to keep their body strong, but then also keep their core firing and get their pelvic floor moving during pregnancy, postpartum, I have been so shocked about how fast they get back to things. Because I typically like to think like, okay, we're not, just put in your mind, we may not run until 12 weeks postpartum if things are going as planned. But some of those women, we get them back sooner than the 12 weeks postpartum of getting into higher intensity, jumping, running activities. And I'm always shocked, but those are the ones that have come in before having the baby.
So
Even that maybe they didn't know they were having a C-section. They're still.
So you're saying you can come in prior to even having a baby? So like
Oh, yeah.
So what does that look like? Like how
Prehab.
far along? Like when you first find out, or?
I get that question a lot. Yeah, like women will be like, I just peed on a stick. I might be 3.5 weeks pregnant. Can I come in for PT? And I'm like, sure, we may not need to see you very often at that point. It'd be like, maybe it's more of a wellness visit. Like, let's talk and see what kind of things you're doing at home. Let's see maybe how the pelvic floor is moving, because it is very important to make sure that the pelvic floor is not a hypertonic pelvic floor, a nice and tight one. We want to make sure that it's mobile, just like any other muscle in the body. It should be able to contract. It should be able to relax. Kegel, reverse Kegel. So we want to make sure that it's moving, because if we have a tight pelvic floor, we're not going to be able to birth that baby come the end of their marathon or pregnancy. So we like to go through full body motions here at our clinic, because they're going to be carrying and holding, basically I say like your little kettlebell or dumbbell at home, your baby, after you deliver, and you need to make sure that your body can withstand that kind of weight and pressure. So we go through all of that here in the clinic, prepping them for birth. That's our prehab is what we call it. Some of our patients we will see maybe once a month, and they're doing things at home during that time. I have some that are like, nope, I want to stay accountable and I want to go through exercises with you. So we'll see them more frequently. But I definitely want to keep them from having, which actually I do like, because if things pop up, like low back pain, hip pain, or vaginal varicosities, which is like awful if you haven't had them. I was blessed with them. There are varicose veins in your vagina and labia, and they, again, feel just like heaviness in your pelvis. And I don't know if why they happen. We do know the support in the pelvic floor is maybe not as strong, but we can help our patients work through that and get strength and coordination built up for them too. So I always think it's a good idea that I wish that would be an automatic referral too. Is like pregnancy, go see a pelvic floor PT, let them get you set up on what you can start prepping for your childbirth. And then, check back in with them again, postpartum, let them help with your healing process. So I think we would see so many more gains of less leaking, less prolapse, less pain with sex than what we have right now.
No, and I agree with you. I know we've at least pitched that for the military. There's a group in the Air Force called the Women's Initiative Team, and they've been advancing quite a bit. So that'll definitely be on the chopping block there. But I do want to ask for the listeners, because some of us are at isolated locations, or there is not a pelvic floor physical therapist in the area. Like, I told Amanda before, it took me 7 months to find one. And it was 45 minutes away is the soonest, is the nearest one. So for, let's say, pregnant first, what exercises, if you can describe, because I know it's going to be hard, what exercises can moms that are pregnant right now do to help strengthen those muscles, whether they have a C-section or not, just to help them?
Okay, during pregnancy, don't forget about your back and your butt. I feel like we spend so much on legs, like leg routine, but really go for the glutes, because you're going to end up with mom butt, and we want to try to make sure that mom butt is as strong as it can be for postpartum. And then mid back here, because once we have a baby, we're in this position where we're rounded forward. So anything that we can do to strengthen those muscles before is key. And then my probably most favorite one is just your lower abdomen. There's a muscle that wraps around horizontally down those lower abs. It's going to start stretching out as that belly and baby are growing. So reminding the body how to contract, like hip bone to hip bone, the lower abdomen below that belly button will be your inner corset to help stabilize you. So you probably remember like moving from sit to stand and feeling like a sharp pull in your abdomen, like the round ligament pain, or moving in bed. And that's what we want to avoid. We want to remind the body how to tighten hip bone to hip bone, a nice gentle contraction in that lower abdomen to support, so we can decrease that pain. So we can roll over in bed, we can go to stand up, and that we can get it to fire when we need it to. Because then postpartum, we want that tissue firing as well, because now you're going to be holding, 6 to 11 pounds, rolling over in bed, moving from sit to stand, and we want to make sure that we're reminding that tissue how to kick in again and stabilize the body. That's probably my favorite one to teach the pregnant moms, because they're like, oh my gosh, I no longer have my low back pain anymore. I no longer have my ligament pain. I'm like, I know. But you'll have a growth spurt while you're pregnant. Like, just when you think like, oh, I got it, it's working, you're going to have a growth spurt, and then you're going to have to remind the tissue again, hey, I need you to connect again. So it's a constant reminder throughout pregnancy.
So now for pregnant with C-section in mind,
Yeah.
because there's just not, I have not found a lot of C-section information out there.
Yeah.
And again, every C-section is different, but in general, when they come home afterwards, what is kind of those beginning steps to recover in your program?
The very first one is the breathing. We definitely need to get the inflammation moving out of the abdomen. And any C-section mom will talk about, like, they just feel pregnant still. Like, there's a lot of fluid. The breath, the diaphragm, and the pelvic floor work together. So as when we breathe into our abdominal cavity, that breath's going to come down and lengthen the pelvic floor. As we breathe out, the pelvic floor is going to bounce back up. So as they move up and down, they're going to help move that fluid out of there so we can pee it out, which is awesome. Great for us. Then after that, learning how to connect with that pelvic floor again, because we want those muscles to move through a full range of motion. So we call them blueberries in my clinic, or sucking up a smoothie with a straw. It's basically a Kegel, but it's not the Kegel because we're putting it back down. So it's more for mobility. So you would pick up a blueberry with your vagina, or suck a smoothie through a straw down there, put it all the way back down, the reverse Kegel. So it's moving it, which is what we want for blood flow, circulation, tissue healing. Now during around, like, those are probably like week 1 and 2, they're also going to learn how to touch the tissue around their incision with their C-section. So it might be grabbing different materials around the house. So maybe, I don't know what this material is, but it's soft and squishy. They might have some clean material like this, or a bed sheet, or a cotton ball. And if the crease between my fingers is my C-section scar, I'm going to go above it from below my belly button down to this area. I'm going to be touching that tissue gently with circles, going back and forth, say with the cotton ball. I'm going to go below the incision, more around my pubic bone with the cotton ball. I'm going to move it up and down really gently. It's all for desensitizing the nervous system, because those nerves are going to be growing back. And if they come back and you haven't done this, you may have experienced like, man, I'm so uncomfortable at my scar when I wear this kind of underwear, or when I wear jeans, or when these pants are touching that area. And we want to help calm that down. So really, grab a pair of jeans and do the same thing across that tissue, but I want it above and below the incision. We don't want to be on the incision until you do get released from your doctor, just because we want to play that part pretty safe. And it's really pretty light in the beginning. And then as tissue starts healing, we can get in a little bit deeper into past that skin layer into more like the muscular layer or the organ layer. But in the beginning stages, you want to stay pretty superficial or pretty close to the top on that skin layer. And then connecting the hip bone to hip bone again for stability. And you can start realizing, like, around the house, like, I like to just tell my moms, like, you're already doing this at the house, so you can make it an exercise. Like when you're carrying your baby, you don't have to lean back, because it's going to put a lot of pressure on that C-section scar or your diastasis recti, your abdominal separation. Get used to trying to stay stacked in a full posture of ribs stacked on top of your pelvis. And when you feel your body go back into this, oh man, I'm exhausted stage, use that awareness, let it kick in to remind yourself to come back. And then if you find that you're going back again, like 7 seconds later, well, then it's probably time to take a break. And the same goes with baby wearing. Like, baby wearing is wonderful and I love it. And I did it with my children, but women have to know, especially as C-section moms, like, your body's not going to be able to last as long as a vaginal birthing mom that maybe didn't tear, like because they always compare themselves to their friends. I'm like, you had a completely different journey. And maybe baby wearing for you is just good for like 4 to 5 minutes at a time until we can get that tissue strengthened and strong enough to be able to support you in that good posture. Because when we get to that bad posture, that's when you're feeling a lot of pressure down there and the swelling is getting bigger and they're noticing their abdomen is pooching out more because it's not ready for it yet.
So that's kind of a limit to watch for is when you're, I think it's been called doming, right? When your abdomen kind of shapes a dome. Is that what we're talking about?
Like the diastasis doming. This would be more like when they're on their feet more, it's more like the swelling kind of gets into that C-section scar and it starts to pooch out because it's exhausted and it's not ready for that yet. A little bit different than the diastasis, but they do go hand in hand a little bit.
Just horizontal this time.
Yeah.
Okay. So last question before I let you kind of go into the biggest question that you've received. For recovery time in general, without any, crazy circumstances that happen to the mom, what should we expect for C-section recovery?
Ooh. I wish I would have known to ask for help, be patient, just really take the time to let your body heal because it was major abdominal surgery. So know that there are going to be good days and bad days. Your tissue will go through phases of healing. So it's never going to be this beautiful, I had my C-section, I'm going to feel great because I'm 2 weeks postpartum, I'm 4 weeks postpartum. That's never the case. It's usually I'm 2 weeks postpartum and now my tissue's healing. So I'm going to start feeling it a little bit more. And now I'm feeling good. Oh, I'm 4 weeks postpartum. I'm going to be going through another healing stage. I'm going to start feeling bad again. 6 weeks, 8 weeks. Know that you are going to have bad days because your tissue, that's how tissue heals. If you didn't have bad days, I would be concerned. Like, what's going on? What are you not doing at home? I think that was the biggest takeaway too, because in your mind, you do think, well, like, gosh, it's been 6 weeks. Like I should be fine. But no, you're so early. Like keep in the back of your mind, like, I don't know. I like to tell people like anywhere from 12 months to 24 months, like that might be your recovery. I would rather put that in my mind instead of 12 weeks. So then if I am getting better before 18 months, like I'm feeling pretty good about myself. But when I start putting myself in a tiny little box that isn't realistic of a 12-week, healing, I mean, that's not realistic for anybody with hormones and lack of sleep. So that's a very long answer for you. I am so sorry.
I think when you just said 1 to 2 years, everyone just clicked off the podcast because they didn't want to hear it anymore. No,
it's so
but
true.
It's good to hear.
And it changes with each baby. Because I will say, like, I probably felt like myself at 4 to 6 months after my first C-section. My second one was closer to 10 months. And then my third one was 16 months postpartum to 18 months, where I finally felt like, oh my God, it clicks. Like this, I can do planks and not feel it in my scar. I can run and not feel it. But each kid just takes it a little bit more out of your body, that your body, it hasn't worked well for 9 months, 18 months, 27 months. It's like breaking up with a guy or breaking up with your partner. Like give yourself double the time to heal. That's probably my best advice.
Yeah, no, I said that because, the branches are all different, but it's anywhere from 6 months to a year. We have to take our physical fitness test afterwards. So women like to start training either at that 4-week or that 6-week mark. Yep. Those are the ones that didn't tear, you said, so they can have at it. But yeah, so it's just that mindset to get past of that your body really does need to heal.
So I mean, it would be interesting to see studies on postpartum military women to see if they're more of a high tone, like tightness because the pelvic floor hasn't healed well, so now it's going into more shock, like, oh, we got to tighten to help out everything. That'd be really interesting.
If you have any contacts, we would love to attack that with you. But I really think you are. Well, we're going to Korea now. Everyone knows that. We're headed there next week. So, all right. I think I can talk to you forever. And I hope we have you back on the podcast later on. But for right now, if anyone wants to contact you, they have questions, whatever it may be, where can we reach you?
We're on Instagram at empower.your.pelvis, or our website is empoweryourpelvis.com. And that's where we've got a lot of our guides on there too. And we do a lot of like 4-week pregnancy exercise classes or our C-section guide. And we do a C-section challenge or group community pretty much every couple of months. So it's fun. I love it. I love helping these women and shedding light on all of this, because I'm so sad that everybody feels like, oh man, why didn't I know about this? Like, why didn't I have this information? So I'm hoping that we can, give people a little bit of hope and help them on their healing process, get them back to their training test so they can accomplish it too.
Yes. Well, thank you so much, Amanda. I really appreciate you having me on. Like I said, we will see you back here.
Awesome. Thank you for having me.
All right, ladies, I hope you took some amazing tips away from Amanda. That was by far the best information on detailed recovery for a pelvic floor and honestly just postpartum that you can get. I don't think I've ever heard that recovery step by step, depending on your tear. No one really talks about that. So I hope you took that away. If not, I'm going to include her guide that she talked about, all her websites, the information in here, all in the podcast notes that can be found at themilitaryworkingmom.com/episode 039.